So this has been a recent change in the for the uterotonics you're using prophylactically according to the latest guideline. So it's there in the previous guideline also that uterine massage it is not a measure for prophylaxis. It is treatment measure. When there is PPH, you do uterine massage, but for prophylaxis,
it's initial measure.
This has been repeated multiple times. Then about vaginal delivery, this is same. If there is no risk factor, similarly cesarean, if there is no risk factor, vaginal delivery no risk factor, what do you do?
We give only oxytocin 10 units IM.
Okay, and if it is cesarean?
Oxytocin IV 5 units.
Okay, and suppose vaginal delivery there is risk factor?
Symptometrin.
Yeah, and in case if you're giving symptometrin or any ergot alkaloids, what do you have to rule out first?
Hypertension.
Okay, there should be no hypertension, yes. Okay, and cesarean section, if no risk factor?
If no risk factor, only oxytocin IV.
You can give oxytocin with, that is oxytocin IV, and in case there is risk factor?
In case risk factor, so we are giving this carbitocin along with oxytocin and IV tranexamic acid.
Yeah, because there are
they give all three.
Yeah.
Okay.
Again, just briefly going through the guideline. So if a patient who is having vaginal birth and has chosen to an active third stage, so then what all options that we have? Oxytocin plus ergometrin, that is your symptometrin. So what is in the guideline? It is more effective. It may be more effective than oxytocin alone in reducing PPH.
Okay.
And oxytocin plus ergometrin is advised if there are risk factors which could increase the risk of PPH. So that's why I told you that there are high risk of PPH, you better give this. Okay.
But if there is a history of hypertension, we have to stick on to oxytocin only.
Yes. And oxytocin plus ergometrin, it more likely to cause nausea and vomiting. So you add
cyclizin.
Yeah, antiemetics. And it is contraindicated. These contraindications you have to know: hypertension, preeclampsia, eclampsia, any pregnancy-induced hypertension, any cardiac disease, hepatic or renal disease.
Okay.
Then, for active management for vaginal birth, you give this. I've already told. What do you give?
For active vaginal birth, oxytocin.
Okay, oxytocin 10 units IM.
Yeah.
Okay, 5 units IV.
IV.
IV oxytocin plus ergometrin. Immediately you can actually, they have said that you can give any of these. Okay, the previous guideline, it was restricted to giving 10 units IM because it is quicker, right?
Okay. Yeah.
Yeah, and it doesn't need you to put a cannula. So that's why. But according to this guideline, you can actually give either of these. You can either give 10 units IM oxytocin, 5 units IV oxytocin, or a combination of both.
Oh, so like in vaginal birth also, like we can give 5 units oxytocin IV.
Yeah.
Okay. So,
but with this factors, effectively you give oxytocin ergometrin combination.
No, ma'am. Like if there is any risk factor, we'll go with the symptometrin. If there is no risk factor,
oxytocin ergometrin combination only, no?
Yeah, if there is any risk factor only. Otherwise, we give only oxytocin, right?
Yeah, but it is also written in this guideline. This text is from the guideline that you can, for active management, you can also give actually any of these. You can either give 10 units, 10 units of oxytocin intramuscular, or 5 units IV, or 5 units oxytocin plus 5
grams. Okay. So for best option would be oxytocin only if they give all the options.
Yeah, and this, like if they give any, like if you get the SBA and they have mentioned all of these options and they have given the option as all of the above, your answer will be all of the above actually.
Okay.
So you can either of these. Okay.
Okay.
Change in this guideline.
Yeah.
And in case if oxytocin is used, you can give it either IM or slow IV for 3 to 5 minutes.
And this means if when they used for augmentation.
Yeah, like if she has PPH later.
No, like what are they saying here? A slow IV over 3 to 5 minutes For women who have received oxytocin during labor means during labor, if she had already, she has to
Yes.
be continued with oxytocin.
Yes.
Okay.
Okay.
Okay, ma'am.
Because during labor, how do you induce? You give IV only, no? Slow IV in the drip in as an
Okay.
infusion form. So you continue that. Okay.
Okay.
And for cesarean section, you can offer carbetocin by slow IV. Okay.
Okay.
So carbetocin, and what is a dose that is given? 100 microgram IV bolus over 1 minute. So carbetocin is also an option according to the guideline.
So in risk when there is risk factor, we are going for carbetocin, also
First,
tranexamic acid, also oxytocin.
yes.
Okay.
No, either it is carbetocin with tranexamic acid or oxytocin plus tranexamic acid. Not you can give either. That's
Okay. Okay.
yeah.
Okay.
For prophylaxis.
Okay.
Okay. Treatment I'll be coming.
Okay.
Okay. After administering the uterotonic, you have to clamp and cut the cord. What does delayed cord clamping means? This we have discussed, I think, previously also. What
Yes.
does delayed cord clamping means? It should be at least
3 minutes,
and not more than
not more than 5 minutes.
ideally. But if she wants
Yeah, on her request.
to be delayed, you can support her wishes. Okay, ideally 1-2.
Okay.
So we have discussed about prophylaxis. Now coming over to management. Okay. So
Okay.
management is easy actually. If there was no like in the physiological management, if nothing was used, then initially first line you can use either oxytocin ergometrin or oxytocin infusion. Second
Okay.
line, if the patient doesn't respond, you go step by step, right? You give carboprost IM, then carboprost IM, and
Okay.
at 15 minutes interval up to 8
Okay.
doses. Again, same with the
Okay.
previous guideline, or mesoprostol 800 microgram sublingual or per rectal.
Okay.
Carbetocin slow IV infusion. So this is how you go about.
Okay.
Okay. This was if nothing was used. If oxytocin alone was used, then your next step will be, first line will be ergometrin IM unless it is contraindicated, or oxytocin infusion.
Okay.
Then if the bleeding doesn't stop, next would be carboprost intramuscular. Then carboprost repeated every 15 minutes to 8 doses, and mesoprostol carbetocin is the last one.
Okay.
Okay.
Okay. If she doesn't want any injection, we can go for rectal.
Yeah. So this we are going for normal delivery. Okay.
Okay.
Third stage of labor we are saying no. So carbetocin comes later.
Okay.
If oxytocin plus ergometrin was used, that is symptometrin was used, then
Okay.
again next line would be first line would be if PPH after this, then carboprost IM injection or oxytocin as IV infusion you give.
Okay.
Or the second thing is if this is not working, then carboprost every 15 minutes up to 8 doses, then mesoprost, then carbetocin.
Okay.
And in case carbetocin was used, then next would be ergometrin. So carbetocin is already, oxytocin will not be an option. Then next is ergometrin, then carboprost every 15 minutes, and mesoprostol. Like
Okay.
so, and in addition to uterotonics, you give tranexamic acid,
Okay.
1 gram IV over 10 minutes, and
Okay.
repeat if necessary after at least 30 minutes.